Hello everybody. Today I'm talking about Virginia Apgar. I was reading a book to my kids the other day. Couldn't decide what I wanted to write for the project. And here she was. Jumped off the page for me. So, Virginia Apgar invented, created, came up with the Apgar score. It's how to test newborns. From an early age, Virginia Apgar was determined to become a doctor. She proceeded in creating the Apgar score. A little bit here for you. Which hospitals still use today all around the world. So as a father, both of my children both needed an Apgar score when they were born. Also, it ties into what I like to do for a living is become a respiratory therapist, which it's all about breathing and helping people to breathe. So if a newborn were to have to be in respiratory distress, they would most likely see a respiratory therapist. My son did have fluid in his lungs when he was born, and they had to do a lavage, which extracts the fluid out. But after he was okay, a couple days in the NICU, as Virginia Apgar would say, nobody but nobody is going to stop breathing on me. So, as you can see, it's still widely used in hospitals today. So for those of you that don't know what an Apgar score is, it's measured in 5 categories: appearance, pulse, grimace, activity, and respirations. Appearance, they're going to judge your baby. If it's all pink, you'll get 2 points. If it's pink in the body but blue in the hands and legs, that's going to be 1 point. And if it's blue or grayish color, it's going to be 0 points. Pulse, you want to see a baby of higher than 100 beats per minute. Anything less than that would be either 1 point or 0 points if there's no pulse at all. Grimace, they like to see a reflex or hip movement, just something to show the baby's moving. Activity is muscle. They want to be able to see that the baby's moving their arms and legs and things like that. And respiration has to do with the breathing as well. Usually if the baby's not crying, or if you have to flick them in the bottom of the feet to bring some type of stimuli to the baby, that's the things they're looking for. You evaluate every 1 minute, and then again after that about 5 minutes later, just to see where the baby has changed at all and where the score's at. So newborns that rate low on the Apgar score, less than 7, are at more risk and need more medical attention. Virginia Apgar, who wasn't a respiratory therapist, she was more of an anesthesiologist, was sitting down in the hospital in 1949 in the cafeteria, and on the back of a piece of paper, she came up with the Apgar score. Virginia Apgar was one of the few medical professionals paying attention to the needs of women and babies during this period of time. There was very little focus on how to improve the mortality of babies and the healthy of birthing mothers. The score led the foundation for the field of neonatology, which is the newborn care and treatment. And Dr. Apgar became a legendary figure in medicine. Prior to the Great Depression, infants would have not benefited from the Apgar score, as Virginia Apgar at the time was only a new student of Columbia University and the College of Physicians and Surgeons. She began to study how anesthesiology affected mothers and babies. a neglected area of research. Meanwhile, as the 20th century progressed, even through more women were having babies in the hospital, the newborn mortality rate remained high. By 1953, the Apgar score was presented and published to the medical world. One would think the Apgar score system would have rapidly caught on, but due to Virginia Apgar being a woman in the field, there was resistance to her contribution to the field. 10 years before Virginia Apgar was born, there were only 7,000 women doctors in the United States. But that number dropped even further around the year Apgar's birth, due to a harsh irony. Though medicine became a more respected, regularly pursued, as many of the schools that offered accepted medical education did not admit women. Yet she proceeds in the spirit of her own quote, "Women are liberated from the time they leave the womb." She pushed through schooling, internship, working opportunities, and made her contributions matter in the medical field. Eventually, the Apgar score became the standard to use when checking how babies were thriving at 1 and 5 minutes after birth. While the Apgar score is an important contribution to the medical field, it's not the only thing that Virginia Apgar was involved in. She also did stuff with the March of Dimes. The March of Dimes is an organization. She helped advocate for the importance of prenatal care, the study of birth defects, and importance of immunizations. In 1969, she helped pass a bill through the Senate for the rubella vaccine. Many people felt it was not a critical issue in the United States, despite a severe epidemic in 1964. But Virginia Apgar did, because the disease resulted in thousands of birth defects and fatal deaths. Dr. Apgar never tired of finding opportunities to focus attention on the well-being of babies in the delivery room. She always believed that it was a primary responsibility of her educational efforts for the March of Dimes to help remove the stigma of birth defects and support the health and well-being of babies and mothers. Virginia Apgar wrote over 70 books related to anesthesiology, the newborn care, and birth defects. One particular book that she had received quite a bit of attention for was Is My Baby Alright?, in which she again addressed the needs of mother and children in the prenatal stage and early infant years. She was constantly using her success to open doors for more research and more change in the medical field, especially for women and children. Virginia Apgar and her contributions to the medical field really mattered to women and newborns, like my kids as well. She was even on a postage stamp. What started off as a bedtime story for my daughter turned into my research paper, which made me see how much Virginia Apgar did for women and newborns and the medical field around the world.